This week, the capital region got a taste of both summer and winter. Temperatures ranged from the 70s to near freezing. It also marked the start of the holy month of Ramadan for Muslim families in the capital region. And a complete closure of the Northway southbound on Wednesday caused an epic traffic backup that's the stuff of nightmares for local commuters. Coming up on this episode of The Eagle, we'll go over the week's top headlines.
I say this to the prankster who might be listening to this podcast. We want to tell your story while at the same time protecting your anonymity.
We'll hear about the efforts of an Albany-based mission to vaccinate as many of the city's homeless as possible.
They had less than an hour to vaccinate 40 people.
So you're fully vaccinated. Now what? We'll hear more about what exactly is safe to do this summer.
You are allowed to gather indoors with a friend or another household that is fully vaccinated.
And we'll hear how members of the Capital Region Islamic community have found a silver lining in observing Ramadan amid a pandemic.
It turns out some of them didn't mind isolation. It gave them more time for the family, more time to attain spirituality, and it wasn't as rushed.
This is The Eagle, a Times Union podcast, a look inside our newsroom. I'm Jessica Marshall.
If you're enjoying this podcast, take advantage of all the Times Union has to offer and support our efforts to bring in you award-winning journalism by becoming a Times Union member today. Go to timesunion.com/subscribe.
Welcome to The Eagle. I'm Jessica Marshall. Okay, let's join Times Union editor Casey Seiler now for a look at what appeared this week in the Times Union and on timesunion.com. But just a warning before we do, some of the subject matter and the sound bites in this segment contain depictions of graphic events, so please listen with care. Hi, Casey. Thanks again for joining us. We're going to talk about the top headlines. Let's start with a mainstay of the Albany skyline these days. The Corning Tower is lit up every night, and it says New York tough, but last week it didn't say that. What did it say, and what happened?
Yeah, I love this story, Jess. Friday night, it was noticed by several people, including passersby to the Empire State Plaza, as well as anybody who can see the Corning Tower. And because it is the tallest building between Montreal and New York City, lots of people in the capital region can see it, especially in Albany County. The large heart had on top of it, rather than the words New York tough, which of course has been Governor Andrew Cuomo's motto for the state's COVID response, it said New York touch. The tail of the G had been transformed into a C. And many people noted that none of the other letters were messed up in any way, leading to the conclusion by many that this was some prankster's comment on the sexual misconduct allegations that have been leveled against the governor over the course of the last 2 months and change. Now, this effect is created, the writing, as it were, the words on the side of the Corning Tower, by raising the blinds and turning on the lights in certain offices. It's very simple. And it would appear, if this was a prank, that someone had simply pulled down the blinds on the offices that, when lit up, would form that tail of the G. So in response, the state state workers went in the days after Friday and zip-tied open the blinds in those offices, which of course led to a union complaint, because if the workers who work in those offices can't close the blinds as the days get warmer, it can get rather hot in there. And I say this to the prankster who might be listening to this podcast. Reach out to Brendan Lyons of the Times Union. We want to tell your story while at the same time protecting your anonymity. In my opinion, Jess, this person is like the Philip Petit of the Cuomo scandal season. And so many of these allegations are so serious and so damaging to the state, of course, and to the governor, that it is nice to have something that has a little bit of levity about it to kind of leaven the serious, of course, of allegations of sexual misconduct and lots of other things.
Of course, if you want to read more about all the things that are surrounding Governor Andrew Cuomo, visit our CapCon, Capital Confidential blog at timesunion.com. This week, in the wake of the killing of Daunte Wright in Minnesota, some protesters took to the streets in Albany. Can you tell us what happened there?
Say his name! Daunte Wright!
Yeah, Eduardo Medina was covering robustly attended. Several dozen people turned out at Townsend Park, which is sort of right at the confluence of Central Avenue and Washington in downtown Albany. It's best known as, the little triangular park with a statue of Henry Johnson, the heroic Black World War I soldier, to protest this latest awful killing in Minnesota. A very peaceful protest that was followed a couple of hours later by a much more lightly attended but much less peaceful protest down at South Station. Where there was sort of a clash at the entrance to South Station, the police station in Albany's South End. Pepper spray was deployed by the police, and it was a bad scene. And it was reminiscent of the first post-George Floyd protest that ended up including violence last spring. And that, once again, was an even larger rally in Townsend Park that was followed later that night. It was a Saturday night I was down there, by a rally at South Station that, while largely peaceful, did devolve into sporadic violence, and a kind of improvised Molotov cocktail was thrown. A panel truck was burned a couple of blocks away, and a lot of damage ended up being done. And hopefully the protest will move more in the direction of what happened in Townsend Park and less so in the direction of what happened at South Station, as the nation and the capital region continues this racial reckoning, as we are dealing with this new killing, and also as the trial of Derek Chauvin, the police officer who knelt on George Floyd, approaches its conclusion. The defense is offering its case right now. It is possible that in the next week or two, the case could go to the jury. That, of course, is something that the entire nation will be watching.
Indeed, indeed. And the events that you mentioned from last year, we sort of took you inside the events thanks to all your great reporting and the reporting of other folks on our staff in a previous episode of this podcast. So go back and listen if you're looking for a refresher there. All right. And finally, everyone was wondering, will the Saratoga Racecourse be open this summer after a very fanless summer last year? What's the latest there?
Governor Cuomo announced in one of his closed press announcements on Wednesday that racetracks will be able to open next week at 20% seating capacity. This is, it doesn't affect Saratoga right now, but it does impact Belmont, which is another New York Racing Association track. It's opening for its thoroughbred season this month. NYRA is, of course, ecstatic, and they are hoping that 20% will increase as more vaccinations come aboard. The Saratoga season, of course, doesn't begin until July. So we've got plenty of running room for folks to get vaccinated, for herd immunity to be achieved, so we can put fans in the stands drinking pricey cocktails and losing their money on the ponies in Saratoga, which is, of course, very, very important to the city of Saratoga Springs, which suffered considerably last summer from the loss of track attendees. As you well know, the number of people who were actually physically at the track last year was virtually nil. It was horse owners, it was employees, it was members of the press, including our own Tim Wilkin, and that was really about it.
We did several really great episodes with Tim Wilkin of this podcast last year, kind of chronicling his experience in this very unusual season, Saratoga season. So be sure to go back and listen to those as well. And I also know that a lot of people around here are eager to get back to their, treasured summer experiences. So more to come on that. Casey, thank you so much for joining us this week, and we will check back in with you next time.
Just a pleasure.
As always, you can read more about all the stories and issues we discuss on this podcast at timesunion.com. As mass vaccination efforts continue across the region, many have been focused on getting the coronavirus vaccines to populations that may not be able to access them as easily. One of those populations is the homeless. Reporter Eduardo Medina recently went to the Capital City Rescue Mission in Albany, where a supply of leftover vaccine donated from a county clinic became a race against time to get as many shots in arms as possible. I spoke with Eduardo afterward about the experience. Tell me a little bit about the overarching story. What was happening here?
The county and the sheriff's office partnered together. County legislators partnered with the sheriff's office to bring vaccines to Capital City Mission. Their goal was to vaccinate the homeless, residents who hang out there, and the staff at Capital City Mission.
Oh, really? I think I heard there were 40 shots, right? 40 shots. 40 shots, yeah.
They originally had 25 shots. And that morning, David Poach, who's the chief of staff at Capital City Mission, woke up and got an alert on his phone, an email saying that they had 15 more shots. So they had 40 shots to administer that day. So that was their mission.
So the thing is, they have to do it within 6 minutes.
It was almost like, it felt like it was an episode of 24 or some show that's really, really fast paced where, the stakes are really, really high and something has to get accomplished before time runs out. Tell us about that aspect of it.
They had less than an hour to vaccinate 40 people. And I mean, something that Capital City Mission has been challenged by is finding homeless people, registering them, telling them about the vaccine, letting them know it's safe. I don't want to say convincing them, but, just bringing awareness to why they should get this vaccine and why it will save their lives, really. David Poach talked to me about how, since vaccine rollouts are underway, he has gotten 250 homeless people vaccinated. The way he's gotten most of those people vaccinated is at the end of the day, the TU Center, the county health department officials will call him and tell him, hey, we have 11 doses, 12 doses left over. Bring as many people as you can. And so he'll take as many homeless residents in his van to the TU Center as quickly as possible before they, run out of time to vaccinate, before the vaccine becomes, not efficient or, unusable. And if there are too many to take in his van, he'll tell the people to walk or fast jog to the place, which is a 5-minute walk apparently. And so it's been this stressful time to save as many of these people as they can.
Nadine, there's a shot for Randall. Can you get a hold of him?
And so that day they were dealing with the same hurdles. They couldn't find many of the homeless people because, many of them don't have phones. Those who do have phones, when they can find work, they have to do work. They have to find money and opportunities when they can. And so if a job came up that day, many of them were calling or texting David that, they couldn't risk not working a day to get a shot because they needed the money. And so it was this race against time to find people to vaccinate.
We were trying to figure out, there's 13 doses left and we're tracking down the 13.
She's here.
Okay, she's here then.
She's coming.
We're going to wait.
The way you write about it in your story, it's just so tense. It came down to the wire, right? The last 2 minutes of the vaccine's effectiveness. Tell us about that.
It's really intense. I mean, obviously the stakes are already intense. Time was winding down. They had less than an hour to vaccinate 40 people, which is already stressful enough. And, a lot of them they couldn't find. But I think what made it particularly stressful for David is the fact that, he, throughout this whole pandemic, this year and months and change, something like that, he has seen firsthand how this pandemic has just devastated so many of these people's lives that they try to help. The pandemic has created more poverty, more people without jobs, more people struggling with their mental health, more depression, and all these issues they were already dealing with before the pandemic. And, COVID-19 hit and it all just kind of compounded. And so for a year, they've been swimming in all these issues. And, they're averaging about 10 calls to 911 a week for overdoses. Every staff member who works there, who volunteers, has had to use naloxone to revive someone who's overdosed. And so it's just been already a stressful time. And to finally have this opportunity to save lives and to know for sure that this person, whether they're dealing with poverty or, drug addiction or what have you, they at least will not or contract COVID-19 because we were able to give them this vaccine. Like, that's a high stakes, and that's what they were dealing with. And, this is the first time they were doing this at the mission. And so it was new, it was a new system. And so it was super tense.
All right, good. Wesley is here.
Just go. Go ahead, folks.
Yeah.
Tell me here for the shot.
It was crowded in there. There were a lot of, it was this nice opportunity for news organizations to go out there and interview the officials and how nice it is that they were bringing vaccines to the Capital City mission. But I mean, in the corner of the room, I just saw David with his paper and his pen scratching away names and writing stuff down and literally jogging around the building. And so I thought he would be the most interesting way to write about this really insanely hard and often overwhelming task, which is to vaccinate the homeless in our city.
Aaron? No, I don't see Aaron. Okay. All right, so Aaron's not here. Clark can't come.
That is a Herculean task for sure. And the way you wrote it is beautiful. You also kind of chronicled some of the reactions of the folks that had received the shot, had been on the receiving end, and how some of them were very happy to be receiving it. Can you talk about them as well?
Yeah, they there wasn't a lot of hesitancy from those who I spoke with. I mean, they were all really eager to get the shot, and once they got it, they were really excited. They just felt relieved. One man told me how he had been struggling with addiction as a result of the pandemic and all the stress that caused him, and he sought out a place that could help him, and that place was the Capital City Mission, and that he went there this past December. What is that, 4 or 5 months ago now? And another person told me about how they've lived in New Jersey, and in New Jersey so many of the people he knew were contracting the virus, and he was so worried, and he never got COVID-19, but it's just been plaguing him in the back of his mind on top of all the other issues he's been dealing with, with struggling with bringing in income. And so there was just a lot of relief there.
Yeah. Tell me here for the shot.
Yeah. What's your name?
I need a shot.
What's your name?
Muhammad.
Are you on the list?
Well, I'm not.
At the same time, when I was there following David, homeless people would come up to him in the hallways and ask him, can I please get this vaccine? And he would ask, well, let me check if you're on the list. And obviously they weren't, because there aren't that many slots. And so he would put them on the back list. And I think that just shows how many of these people are eager to get this shot and are eager to be safe from this horrible disease. It also showed how David is, balancing all these emotions with people desperate to get this, or people who don't want to get it, but he's convincing them to get it. And so it's just a busy time, I think, for them.
He has five shots, he said, left, so he just needs 5 people. So I don't know. 5 shots left.
I got the backup list here. We're going off the people that signed up for the
So
backup.
you got everybody then you need.
I think so.
Yeah.
Well, you're at the end.
How many more doses do you guys got?
After the break, what can you do once you're fully vaccinated? We'll explore the CDC's guidelines.
Hi, I'm Casey Seiler, editor of the Times-Union. Join us for an ongoing discussion on major developments in the saga of Keith Raniere, co-founder of NXIVM, the shadowy upstate New York organization at the center of the explosive federal investigation that resulted in Raniere's conviction on charges of extortion, sex trafficking, and more. We talk to former members of NXIVM, discuss the latest news, and preview the likely next twists in this bizarre and disturbing story. You can find NXIVM on Trial at timesunion.com or wherever you listen to podcasts.
Welcome back. You're listening to The Eagle, a Times Union podcast. I'm Jessica Marshall. More than 320,000 Capital Region residents have been fully vaccinated against COVID-19 to date. And the question on many of their minds and minds around the country has been, what can I safely do? The Centers for Disease Control and Prevention has issued a series of guidelines, and reporter Claire Bryan took a closer look at what they are. I asked her what she found out.
I love the headline of this story. It's, so you're fully vaccinated. Now what? Give us a, 35,000 foot view.
I was curious, as I'm sure all of us are very curious now as we're starting to get vaccinated, or we're past our 2 weeks and we are fully vaccinated, what exactly we can do. And although this is a question that we've all read about and have been talking about, I wanted to understand it a little bit more clearly and really see what the CDC guidelines were and speak with an epidemiologist and a public health expert about why the CDC guidelines are the way they are. And they make some really clear specifications about travel and about indoor gatherings, but they also don't go into detail about other things like outdoor gatherings and bars and restaurants and stuff.
Give us, 4 or 5 things that we are now allowed to do.
I think first and foremost, what stood out to me is you are allowed to gather indoors with a friend or another household that is fully vaccinated, which I think is great news and something that we've all been looking forward to. You're also allowed to gather indoors with one household that isn't vaccinated if you are fully vaccinated. Beyond that, the CDC doesn't exactly specify how many fully vaccinated people or households you can gather with indoors. But from the reading and from speaking with an epidemiologist, it seems to be pretty specific, just speaking like one household gathering with another or one household gathering with one or two. It's not encouraging
house parties,
not at all.
Wild ragers that we've all been waiting for.
Unfortunately not.
That's too bad. Just kidding. I don't have raging house parties. Okay, so what else? So we can gather in very small gatherings at people's houses without masks. What else?
We can travel, and you don't have to negotiate or navigate do I have to take a COVID test before? Do I have to quarantine? It's free to travel domestically within the country without that. If you are traveling internationally, you should still check to see if the country that you're going to has requirements. They might have a COVID test requirement before or after. But that being said about travel, even though you are traveling, it's still best to wear a mask because you are in a public setting indoors with a lot of people. You don't really know if the people next to you are vaccinated or not. And so it's best just to be courteous to everyone, especially given the fact that not everyone's had access to get the vaccine maybe as quickly as you, to still wear a mask while traveling.
Now, that's an interesting point that you bring up because this always gets confused, I think, that people wear masks not to necessarily to be protected from others, but to protect others from you, right?
Yes. And, everyone has a little bit of a different situation, and you just don't know when you're in public around lots of people, especially for people of color. The vaccination rate in certain neighborhoods is as low as 20 or 30%. That might not be the case for you. It's out of respect for them. And also the mask wearing in public. I mean, it comes down to the fact that we still don't know a lot. And there is still information developing about the vaccines. And while, of course, they are extremely effective, and that is extremely good news to be excited and hopeful about, there is still a slight percentage and this unknown that we might know even more about, even soon, even in the next few months or the next 6 months, we might know more. And that's something else the epidemiologist told me was that, in 3-4 months, these guidelines might change and we might even be able to do more. It's just a period of waiting and seeing and still staying relatively safe, even though more people are becoming vaccinated.
Sure. And that's a tall order for a lot of people. I know we are all itching to get back to life as normal, but not just yet. So tell me, who did you talk to locally?
The easiest thing to say there is honestly just everyone in public wear a mask.
I talked to Eli Rosenberg, who's has a PhD in epidemiology, and he's a professor at University at Albany.
This will look like a very different summer depending on where you live and based on those vaccine rates, race, ethnicity. The risk is very different.
As well as Dorcia Pleers, who's a doctor of public health and assistant professor also at University at Albany.
All right, so we can gather in, small groups, as I said, and you said before. We can travel. What else can we do? What with regard specifically to bars and restaurants and maybe large events like weddings and stuff?
Here's where the guidelines are not so specific. And I think that, the experts that I talked to really spoke with a lot of caution in terms of larger events. So being outdoors, as we already all know, is definitely the safest option. And they even encouraged, if you are outdoors at an event and it's a large crowd where you're in close proximity, it's a good idea to go ahead and wear a mask because you are close to those people. But, I think they also recognize that it's summertime. People are really excited about socializing again. And if you can do so outdoors, then that's great. And I mean, I always think of that too. Like when the weather is nice, I want to be outdoors anyway. So if I can eat outside, that's even better. With big events, New York State has released guidance for larger events and sporting events. And obviously those types of things are happening, and those venues have their own restrictions. And so, you need to be respectful of following those restrictions and kind of doing a risk assessment just as you would earlier in the pandemic. Now, of course, you're vaccinated, so you're that much safer, but there's still the same risk assessment that you probably need to be thinking about before just deciding to, run into a big crowd, even if it's outdoors.
We are a lot further than we were a year ago, and I anticipate that we will continue to see that progression if we follow the guidance that has been set.
I'm assuming that you have been vaccinated or are planning to get vaccinated. So if that's the case, what are you looking forward to getting back to doing that, you haven't really been able to do this past year that is, of course, safe to do?
Yeah, that's a great question. I've gotten one dose. I'm like halfway vaccinated. And I think I'm just excited to spend time with people outside and not be worried. Like I said before, I'm a big proponent of being outside no matter what. And so I'm excited to see more friends and maybe go to slightly larger gatherings with friends outside and not feel a sense of, oh, is this the right thing to do or not? And really, and just feel a little bit more comfortable being outside, bopping around and seeing more people as the weather's nice. And that, maybe that's a boring answer, but because I know like that's not all that different, but like I am excited to just, move a little more freely around.
I hear ya. I share that sentiment wholeheartedly.
I am optimistic. Yes, we will get there. There is some light at the end of this tunnel.
Monday marked the start of the holy month of Ramadan. For Muslims around the world, it's a time for focused daily prayer, spiritual reflection, and fasting. It's also a time of shared evening meals, gatherings, and worship that culminates in the joyful celebration of Eid. News desk coordinator and writer Azra Haqqie recently spoke to members of the local Islamic community to see how they're adapting their observance as they begin the second Ramadan since the pandemic began. I spoke with her to find out more.
Ramadan is one of the 5 pillars of Islam, the other 4 being faith in one God, daily prayer, charity, and pilgrimage to the holy sites in Mecca once in a lifetime if you're healthy and able. So Ramadan is really the 9th month of the Islamic calendar, which is a lunar calendar. So Ramadan's about 10 days earlier each year. It does involve giving up food and drink, even water, all during the day. And most people focus on that, which is, of course, a huge part of it. But really, the idea is to be more God conscious, to increase spirituality, And by giving up food and drink, you kind of realize that even though when you break your fast, you may have varieties of food to eat, there are people who have nothing. There are people who are starving or making do with very, very little. So that's also to create awareness of people who may not have much to eat or may have almost nothing to eat. Like we see refugees these days, or even with the pandemic, there's so many people who are food insecure.
Mm-hmm.
And the Quran was revealed in the month of Ramadan. So the Muslims spend more time reciting verses from the Quran. It's a form of worship. I think it was a command from God to Muslims, conveyed through the Prophet Muhammad. And all healthy Muslims who do not have a medical condition, who are not very young or old or traveling or pregnant women are expected to fast. They're required to fast. If for any reason they cannot, and it's much of a hardship, they may give it up. They may not fast.
You know, upon sundown, the tradition is to share a meal with friends and family. Can you talk about what that is and what it you know, how it's typically carried out on a non-pandemic year?
Traditionally, families or friends meet in the homes, or here they would even meet in Islamic centers on a bigger scale. Sometimes it's a potluck style of meal. Sometimes it's a catered meal in the Islamic centers, or people choose to invite a few friends or family members into the house. Traditionally, the fast is broken with sweet dates. It's only traditional. There's no compulsion. When my kids were little and started fasting, they liked to break the fast with M&Ms. So
they're sweet.
Rigid. Yes, nothing rigid there. There are prayers, and then there's the meal, and there's kind of camaraderie, there's fellowship and gaiety. So it's a happy time. You share a meal after having fasted all day.
Now, you spoke to members of the community around here who shared their experiences in the past year, because obviously this would be the second Ramadan since the pandemic started. And,
yes,
you know, the pandemic obviously made it near impossible, if not impossible, to gather for the iftar. It's made it near impossible. So people had to kind of alter their traditions. So can you talk to me about how people around here have done so and how they've kind of coped with pandemic Ramadan?
Yeah, I think the first one was really a surprise and a bit of a shock to most people. It turns out some of them didn't mind isolation. It gave them more time for the family, more time to attain spirituality, and it wasn't as rushed going to school or college or work. So it was a more peaceful, more serene atmosphere is the feeling I got. And one of the ladies I spoke with said she or her family members cooked something and delivered it to the front steps of their friends or family. I think the Islamic Center had prepared meals and delivered it to the homebound, people who would appreciate a home-cooked meal. Maybe they were not able to cook too often, or to the people who were not able to financially put together a good meal. So they often did that. And they also put together bags of or boxes of groceries and delivered them to the houses of people who were on the list of the food pantry receiving end.
Now, this year, I mean, people are getting vaccinated. The rules and guidelines, I should say, are getting relaxed a bit. What are folks saying that their plans for this year are going to be?
To the best of my understanding, there's no gatherings for food. There's no gatherings to break iftar and share a meal in the company of your friends or family. If people choose to have a small gathering at the house, that's different. But I don't think any Islamic centers are having the big get-togethers. There are some Islamic centers who have chosen to open for the congregational nightly prayers with limited percentage as per the guidelines. And those are pretty strict rules too. You have to be 6 feet apart. You bring your own prayer rug. You do all your cleaning, washing up, the ritual washing at home. They don't want to open the restrooms to have people go in there. So with some restrictions, there is some level of getting together.
So there's a typical celebration at the end of Ramadan called Eid. How has that been affected?
Usually there's a prayer gathering. It's like the bigger Islamic centers can hold 1,000 people. And then after that, there's usually a reception and people are dressed in ethnic outfits and colorful outfits, and the children get gifts and candy packages from Islamic centers. So last year, there was none of that. It was pretty much in isolation.
Mm-hmm.
And the area mosques got together and had one of them do a service on Zoom. During last Ramadan, the services did go on Zoom, so people could, or whatever online platform, some went with Facebook Live, etc. And you could tune in and listen. But for the Eid celebration, that's pretty much all it was.
That's it for this week. I'm Jessica Marshall. We'll be back next week with another look inside the newsroom here at the Times-Union. In the meantime, check us out on Facebook, Twitter, YouTube, and Instagram, or head over to timesunion.com for the latest news and features. The Eagle is a production of the Times-Union. It's produced and edited by me, Jessica Marshall, with help from the Times-Union digital team and the newsroom.